So it is my pleasure and privilege to introduce our speaker. It sounds like a lot of us have come out specifically to see Mary today. Most of us have sat with a client, I'm sure, who has a loved one who is an addict, a drug or alcohol addict, and sat with their helplessness and frustration and guilt and anxiety and fear and codependency, shame, right? And this is exactly what Mary is here to help us work with, the codependency of the parent of an adult addict. Mary is an MFT, a licensed advanced alcohol and drug counselor, a certified alcohol and drug counselor at the highest level, and a doctor of interfaith ministry. She's from the San Jose area. She's actually the founder and coordinator of the San Jose City College, Alcohol and Drug Studies program. Awesome. And she has 2 books, Awakening Hope, a developmental behavioral biological approach to codependency treatment, and Afraid to Let Go, which is also the title of today's talk. So thank you so much, Mary, for being here, and welcome.
Thank you. I think I'm using it.
Oh, yeah.
Okay. Yes. Can you hear me? Okay. All right. Thank you for coming. This is my very favorite topic. I've been an MFT since 1988, and have been working in the recovering community since 1990. And so I've pretty much always had a general practice and worked in addiction simultaneously. And so I've had a lot of overlap and had a lot of personal experience as well as professional experience with what we're going to talk about. And the way this came about is my first book, Awakening Hope, was really written for adults in adult relationships. And the premise is that codependency, the foundational piece of codependency really is disrupted attachment, okay? And that when you have, you want me to be over here? Okay, sorry. Oh, okay. All right, so when you are struggling with attachment issues, you're going to have a lot of adrenal system fight or flight reactivity. And so we're going to be talking about 3 different pieces today, which is the attachment disruption, the behaviors, anxious and avoidant, that go on with that, and then we'll be talking about the adrenal system consequences, okay? So I wrote the book originally for adults, and then I had a lot of requests for people to help, for support around working with parents of adult children. Because there were and are a fair amount of materials for working with adolescent addicts, but not as many, particularly for parents. And if you've ever worked in treatment facilities, you know that dealing with the parents of adult addicts is often one of the most challenging pieces. In fact, the addicts themselves can sometimes be easier to manage and work with than the parents, because you're looking at a tremendous amount of anxiety and powerlessness and helplessness. And so when you are the care provider or you're working on the treatment team, you're receiving this bombardment of anxiety. Okay, do something, panic, fix it. And interestingly, if you also have ever worked in treatment, you know that many people who work in treatment are recovering people themselves. And so the other piece I noticed was that the recovering people would often be triggered by the parents and family members of the addicts they're taking care of, right? So you'd hear things like, I don't want to talk to those people, I'm not doing family day, those people are nuttier than the addicts. I mean, a lot of reactivity from the counselors who had not necessarily addressed their own early work with their own parents and leftover issues with their own family members. So it is a difficult and emotional population to work with. So I'm glad I get to talk today about this. If you are a codependent parent, you are not a control freak, a helicopter parent, or suffering from empty nest syndrome, okay? You are terrified. The premise we're talking about here is that you are not necessarily codependent because you have an adult child who's an addict or alcoholic, okay? And what I'm looking at here is a difference between enabling behavior and foundational codependency. So what I'm going to be doing, I think for the next hour and a half or hour? Okay, hour and a half. Is I'm going to be looking at the difference because there really is. And what you will notice with some families, particularly if it's enabling versus codependency, that information does a world of good. You send them to Al-Anon, they hook into a sponsor, they start working on themselves, and they start implementing what they're learning, and they begin to actually move into recovery themselves, regardless of the sobriety of their loved ones. Okay, so many people, they come to Family Day, and they're really able to take what they're learning. This is a population where that is not true, where you can send them to Al-Anon, and they're too anxious, they're too agitated for Al-Anon. They have a very difficult time going. They have a very difficult time working with a sponsor. Their ability to actually implement what they're learning in family treatment is pretty poor. And so we're looking at people who are very, very anxious. So it isn't just, any parent that has an adult child who is an addict or alcoholic is going to be anxious. Okay, it is anxiety provoking to be with somebody you love and watch them run toward the train. Okay, because every single bone in your parent body says, get out of the way of the train. Okay, you want it, and you can't. You cannot do anything about it. Of course, you're anxious. Okay, so I would not say, and I don't believe every single person that has an adult child is anxious, is codependent, because they're not. This discussion is about parents who are afraid to let go because they don't know how to set boundaries with their adult children without feeling crippling anxiety, or you will see this also, walling themselves off. Okay, so you'll see one of two things, right? That anxious, like I had a parent who would drive her child to the heroin dealer's house, right? Because at least she could control making sure how much she bought. Okay, that kind of thing. To the parent who says, that's it, don't call me, you're dead to me. That's how they manage their anxiety. You're gone. Okay? They can't let go. They can't detach with love. They'll sit in a meeting. Can I move this? This is annoying to me. Okay. They'll sit in a meeting, and they will, they'll hear terminology like surrender, detach with love, and what they hear is, you want me to abandon my child. Okay, you want me to just, not love and not care. They are not able to implement the strategies they learned when they're faced with their adult child's chaos and anxiety. And in fact, when they try to implement what they're learning in treatment or they're learning in Al-Anon, it makes them physically ill. Okay, they literally wind up having all kinds of adrenal system difficulty, chronic fatigue, systemic illness. That this issue, this attempt to control this, makes them sick. So we're going to address the parent that struggles with attachment issues, difficulty in their primary relationships with separation and bonding before they ever had children. So what I'm talking about today are parents who are codependent and had patterns, okay, their attachment patterns were present before they ever had children. Okay, they're not caused by children. Codependency is not catching. Okay, all right? So the definition we're going to use is that at its heart, codependency is a set of behaviors developed to manage the anxiety that comes when our primary attachments are formed with people who are inconsistent and unavailable in their response to us. Our anxiety based responses to life can include overreactivity, image management, unrealistic beliefs about our limits, attempts to control the reality of others to the point where we lose our boundaries, self-esteem, and even our own reality. Ultimately, codependency is a chronic stress disease which can devastate our immune system and lead to systemic and even life-threatening illness. Okay? So we're going to take this apart, all right, and break it down into 3 different sections. We're going to start with attachment. That codependent parents develop their parenting responses in response to the attachment they formed with their own caregivers. Essentially, if they're unable to trust their attachments to those who are close to them, their adult child will not be an exception. Right? So if I already have difficulty trusting the permanence and the strength of my attachment with my significant other, my friends, my siblings, my coworkers. Having a child won't cure that. And that's actually something that's pretty amazing to a lot of parents, because they assume that I'm going to have somebody that I'll have this unconditional loving relationship with, and you know, in a way it'll heal my attachment issues. The difficulty is that, you know, once they're mobile, they have choice. Okay? And then the anxiety comes back, right? And then they get into adolescence and they don't want to play with you anymore. In fact, they don't even be seen with you in public, okay? So it is not, in fact, a cure. They don't trust their children truly love them or would actually choose the relationship with them any more than they trust the other adults around them. Okay? So this issue, and I hear this with parents where they'll say, if I set a limit, they'll leave, they'll never come back. I'm afraid my child will never speak to me again. I had a mom who had a 50-year-old son who was literally having, you know, insulin shock and passing out in his office and his home. And so she brought him in to live with her, which of course we all know is how you manage that when it didn't work. So he continued to have these issues in her home, so she had to call 911, okay? And when she came in, because she tried Al-Anon, her sponsor sent her in for therapy, and her issue was, if I tell him he can't live with me, because she was like 79, he can't live with me because I can't manage this, he will die. That will be on my conscience, and I will never get over it. So this issue of, and she says, even if he doesn't die, he'll never call me again. He'll never speak to me again. It'll be a deal breaker. Now, as the outside person who's working with this parent, I know that her 50-year-old son is very dependent on her. Okay? Chances are extremely high. That's not going to happen. But to the codependent parent, it feels very, very real. Okay? Very real. So it was making her very ill. Scary situation. They are intuitively afraid that if they let go, their children will not willingly return. And that's why they allow their adult children to depend on them, need them, and resist allowing themselves to depend on their adult children even after they become sober. So this isn't cured just with children who, you know, even after their child does the hoped for, you know, I'm clean and sober. I'm living my life. I'm working in my own, you know, living in a sober living home. My life is better. The anticipated reduction in anxiety doesn't happen. Okay? Now what happens is, what if they don't stay sober? What if I say something that upsets them and they'll drink? What if I set a limit and that's it, they run out to the dealer? So again, this perception of life and death. You know, that everything, and if you think about it, if every relationship you had, every exchange was a potential deal breaker in the relationship, that's extremely hard to live with. Okay? That's why the adrenal system's like, constant fight or flight. You know, everything feels like it's a risk. It's a risk to be honest with my adult child. Okay? It's a huge risk. Addicted adult children are erratic in their availability and response. They disappear for stretches of time with no response to any form of communication, and then suddenly they appear in a crisis, right? So it's very normal for when people use to avoid their families, okay, and then pop up. So you have this jack-in-the-box, right, thing. Their response level may depend on their level of intoxication, perhaps incarceration made them unavailable, but worst of all, the separation we fear the most, the death from an overdose or violence, can become permanent. And so one of the things that is hardest for these parents is the reality that their particular adult child has chosen a path that can result in their worst fear, right? That in fact, they will overdose and die, and they do. Or they will pick up a charge that, you know, they're incarcerated for the next 10 years. Now, for a lot of parents of alcoholics and addicts, incarceration is not the worst thing. In fact, that's often the best thing that could happen. In fact, that's the only time they sleep. Right? They're like, oh, thank God he's incarcerated, okay? Because now they can rest, they know where he is, he's not running amok. I mean, you know, it's when I've worked in treatment, you know, the addicts and alcoholics themselves say, oh, that's so mean, you know, that they're happy when I'm arrested. But, you know, the alternative is that 3 o'clock phone call from the morgue, having to pick them up from prison because they're suddenly released at 2 in the afternoon, whatever. So yeah, incarceration doesn't seem so bad. Same thing with residential treatment. You know, the people who look the best in residential is the family, right? The first family day, everybody looks like a raccoon, right? By like the third, fourth family session, everybody's looking well rested. The family gets tremendous amount of relief. I used to have a program when we would do 45 to 60 days, and the family always wanted the 60-day to 90-day plan. Okay? And the addict always wanted the 30-day to, day plan, right? So you always had this thing, but for the family, it's like, oh, they're safe. They're safe. And when you're using, of course, you're numb to this. You're numb to this, the level of terror that the people who love you might be experiencing. So if I grew up with parents who were inconsistent and unresponsive in their behavior towards me, and then my adult child behaves the same way, it makes sense that the same anxiety I experienced as a child would surface when faced with the same situation. So the same coping mechanisms I developed as a child with my own unavailable parent will surface again when my adult child becomes inconsistent and unavailable. I'm going to be triggered. I'm going to be triggered. So if we go back to our definition, that at its heart, codependency is a set of behaviors developed to manage the anxiety that comes when our primary attachments are formed with people who are inconsistent or unavailable in their response to us. We start with bonding, okay? And of course, what we're going to be talking about is John Bowlby, right? Because you can't have an attachment conversation without Bowlby. I mean, I don't know how you do that. Okay, so secure bonding and attachment between caregivers and their children sets the foundation for future connections with others. So bonding generally refers to a parent's emotional investment in their child. Okay, and that's going to grow with meaningful contact. So it goes parent to child. Attachment refers to the tie between infant and parent, and the child will initiate and participate in that. Okay, so bonding can go this way, attachment, child to parent. The quality of attachment largely determines a child's developing sense of self and approach to the world and their environment, okay? Because, this is our very first model of how we are going to be in the world. So, experiencing a secure attachment bond with our primary caretaker, and in many cases, that could be mom or grandma, means that she responded to our needs when we needed her, and she was so available we had a secure base to explore the world from and return to if we needed to be comforted or needed to be safe. That whole idea that I am not going to explore the world if I don't have a home base. Okay? I need to feel secure, to take risks, try new things, explore. I need to have some place that if I need a net. Okay? That's going to give me courage. And one of the things you will see with addicts and alcoholics that's striking is their lack of risk-taking. Now, they'll take risks that have to do with their personal safety because they don't care about themselves, okay? But taking relational risks is terrifying to them, okay? So yeah, they'll ride a motorcycle 150 miles an hour, or they'll, throw themselves off a side of a cliff, but, bungee jumping, whatever they're doing. But you ask them to have, to be honest in their relationships with somebody, panic. Okay? They don't like to, or to go to a job interview where they're going to have to put themselves up, terrifying. Okay? So that risk, that foundational platform for risk is key. The deal, we need to be able to bond without being swallowed up, which is going to contribute to our autonomy and our creativity. So the idea is I need to be able to bond with you, and you're not going to move in with a U-Haul. Okay? Because, it looks like that. I love that picture. Okay? And we need to be able to separate without feeling abandoned. Caregivers are attentive to the child's cues for reengagement. This is key. The child needs to be able to come and go. Disconnect, connect, disconnect, connect. And as a caregiver, I'm available. Okay? I'm willing. I'm paying attention to those cues. Now, for anxious people, this response is unpredictable, and we only get intermittent reinforcement for turning to the attachment figure for security. So we're going to need to be vigilant for her presence and loss, and that's strongly reinforced. So what happens is I become so external in terms of monitoring, your availability, that my ability to learn and self-soothe and respond appropriately to threat is not developing, okay? So all of my coping mechanisms are being developed to manage external threats to my security, right? So if I don't know if you're actually going to respond, or I don't know if you're paying attention, I need to stay alert, okay? And that's where you get that vigilance. That's where you get the vigilance. And you know, there's lots of reasons people are not available. Okay, and many of them have nothing to do with love, right? Incarcerated people love their children. I can have an extended hospital stay because of an injury or an illness, and I'm not available. I could be deployed to Iraq. I still love my children. I'm not available. So just because somebody's not available doesn't necessarily mean that there's not a bond or an attachment. The difficulty is that because children are completely self-centered, the unavailability will be attributed to something about them. Okay? So it's not, it's sort of like, well, if I was smarter, taller, funnier, cleaned my room every day, you'd be available. Okay? Because children believe that everything that happens pretty much is about them. Okay? It kind of starts that, in Al-Anon we talk about going to the hardware store to get milk. Have you ever heard of that? Where we talk about, going to some place where something's not available, right? So I go to the hardware store and I march up and I demand to have milk, and they don't sell milk there, and then I accuse them of withholding it. Okay? Or you're selling that milk to other people, probably thinner people, taller people, smarter people, right? And then I have a tantrum, right? As opposed to go to the grocery store, right? Where they actually have milk. So this anxious piece starts out with the, okay, I'm gonna try to get you to be available to me. Now, avoidance, some children do not receive a response at all. And avoidant child learns that seeking closeness through crying and clinging is futile and actually results in parental withdrawal. So instead, independence is reinforced and valued. As a result, attachment behaviors are relatively deactivated and detachment becomes prominent. So for some children, it actually makes their situation worse to try to bond and attach, okay? Because there are certainly parents who are overwhelmed, either by their own mental illness or their own addiction, or maybe they've got 7 children or they're working 3 jobs. They're overwhelmed. And so the message the child gets is every time they have a need or they want something, it's too much, right? It's too much. Just take care of it yourself. And so what happens is we become really good at taking care of ourselves. We get very good at meeting our needs. We know when we need something, we can handle it. And what's deactivated is the belief that other people are a potential solution to the problem. Okay? What happens is we are the resource. And we stop thinking of people outside of us as a potential resource. Now, internal working model is the Bowlby construct. Explain how early attachment experiences become long-term and lifelong traits. So with repetition over time, the infant's conditioned into generalizing their experiences to expectations for future relationships. So this idea that this is my early experience, which is I'm available, you're not, or you're available, I'm not, becomes generalized. And one of the things that from just basic psychology, we pay attention to what cognitively we recognize, right? So what I'm going to do probably by the time I'm 20 or 30 is I will have amassed many, many pieces of evidence to prove to you that my working model is correct, that people are never available, okay? It never happens. And I can give you multiple examples. Okay, so the setup is, and so what you'll see is people who, even in childhood, will begin to, pick friends that aren't available or friends that dump them without notice. And we start to create this perception that relationships are unreliable, they're not worth the investment, and terrifying. So a child's response to negative parental treatment can be generalized as follows. We have an avoidant, dismissive child who develops a deactivating strategy. So, you get the person who grows up to sort of under stress, checks out. I'm not playing. The kind of person who, if you stress me, I won't return your calls, right? It's over. And I see this with clients that, as adults, somebody starts to push on them a little bit and they bounce. Done. I don't need this stress. So they don't have bridging behaviors. They don't know how to bridge back into healing. And so you can imagine as a parent, if I lack bridging, okay, then I'm not going to know how to re-engage once my child has hurt me. Okay? Our children can hurt us. One of the hardest things about having children is it's like your heart is on the outside of your body. Okay? And it wanders around. And it has the ability, this person, because of our level of investment, absolutely devastate us. All right? And so that level of attachment, for at least bonding from our point of view, can really trigger us to quickly, as soon as we're hurt, say, okay, you want your independence? You want to be 18? Be 18. Right? And you kick them out. And tell me how that works out for you. Right? Because there's no ability, we didn't learn it in childhood, to have a conflict with our child and work it through. So it's a deal breaker. I guess the relationship's over. Right? The anxious, ambivalent child, this is the hyper-vigilant strategy. So we're watching all the time. How we doing? How we doing now? We doing okay? How we doing? Okay? So this is the kind of person who, with their adult child, is texting them, calling them, how we doing? How we doing? I had a woman sitting one time interviewing with me. I had a treatment program, and she was trying to figure out if she was going to bring her daughter to treatment. And at that time, her daughter was in jail. And even during that 1 hour, her daughter must have called her 5 times from the payphone. Every time, picking it up, picking it up, picking it up. That sort of, okay. Constant watching, constant, oh no, right? I don't know about you, but I have an amazing amount of people who now put GPS on loved ones' cars, phones. It's amazing. It's amazing to me that that's become a sign of love, right? That I'm going to put a GPS on you. I think I tease them about like tattooing it on them, just so you can just like barcode them, because there's that fear, that I need to know what's going on with you all the time, and that's worse with an addict, right? So I'm going through their cell phone, looking for their dealers, calling strange numbers. Who are you? Who are you? Who are you? Very hard. So this is the foundation of adult codependency, this idea that I don't trust this relationship. So I'm either going to disconnect at the first sign of pain, okay? Or I'm going to hunker down when there's pain, right? Because I'm afraid. Both are incredibly anxiety-provoking. Traditionally, when we've talked about codependency, we've talked about the anxious people because they're so obvious, right? They're calling the treatment center. Okay, how's my husband? How's my husband now? Okay, now how's my husband? We know who they are. The avoidant codependents haven't gotten a lot of press because they tend to look more like the Erickson, definition of health, right? Independent, take care of their business, kind of needless and wantless. Traditionally, even if you look at it in an exaggerated sort of definition of manhood, right? We got it going on. So avoidant codependents tend to see themselves in much higher self-esteem than people who are anxious because they feel like, they're independent, they don't need people. They're both equally anxious, all right? But they don't look as anxious because they don't allow themselves to get close enough to get anxious, okay? Because as soon as somebody starts to get close enough, right? So yeah, avoidant people, yeah, they tend to look really much stronger, much less crazy. Problem is, the minute they let themselves get close to somebody, it's on. So you see the swinging, and what people will say is, well, I'm either one or the other. Well, that's right. Because what I'll do, for example, is I'll allow myself to attach to you, get insane, and then my next relationship, that ain't going to happen, okay? I'm going to make sure I find somebody nice man, make a good father, right? So that I don't have any feeling that could get hurt. And you see that with people who get, I'm not really going to connect, but you're pleasant. 2, passion, enmeshment, insanity. I was doing a women's group, and this woman was describing. She said, I think I know what you mean. She said, one time I was on the roof, of the apartment across from my boyfriend's house. I'm like, I love the start of that story. I said, oh, all right, I'm with you so far. Okay. And she said, I had my binoculars and I was watching his front window. And I said, all right, what were you looking for? She goes, well, I thought he was dating some skank. And so I was watching for her truck, right? And I said, okay, I got it. So what would you do if the skank was at the house? She said, well, that's okay because I had a bat. I'm like, all right. And so your plan was what? You were going to, I had a bat in my truck. I was going to go get my bat and I was going to go kick in the door. I said, okay. And then you were going to swing and he was going to say what? Oh, what was I thinking? Of course I want you, darling. I mean, that's not what happens. What happens is a domestic violence charge. She gets arrested and he spends the rest of the night with a skank. That's what really happens, okay? But our version of, I need to show how much I love you, how much I care. I really need to, have a lot of drama because that means we're connected, right? Versus the avoidant people who even sniff drama and they're like, oh. I mean, they interpret stuff as drama that's like not drama, like asking what you're doing today. Like, get off my back. Yeah. Right? I had a client do that. She told me that this guy she met was interested. He had texted her 3 times in a week, and she comes to therapy and complains that he's all over her. She goes, oh, he's stalking me practically. I said, he texts you 3 times in a week. For her, that was stalking, right? I have other clients where if they don't talk 15 times a day, we're not talking, right? We need to be on it. What are you doing now? Now what are you doing? So very, very different. So parents will need to resolve their own attachment needs in order to tolerate a child's growing need to differentiate and establish a self apart from the parent, right? Anxiously attached parents are going to be really threatened as the child grows, wants more space, wants more independence, right? This is the phenomena you have where, my child is my best friend and now she wants to have a sleepover at somebody else's house and I'm devastated, right? And I may smother them. Right? Where I insist that they be my best friend and that they go everywhere with me and we do mani-pedis together and we, I take her everywhere. Avoidantly attached parents find the child's resistance or protest painful because they anticipate the eventual withdrawal and so they go, fine, go do what you need to do. Right? What does it look like when a parent cannot connect this way? Hang on a second here. Oh, this is from I'm going to use examples from my book because, my marketing person said I'm supposed to be doing that. So here we go. Like most therapists, I can't market my way out of a bag, so I have to have somebody help me. All right. Why is that? You know what? They really should teach that, shouldn't they? In graduate school. Like, how are you supposed to get a practice, right? We go through, we have all these skills, right? And then we sit in our office and wait. Right? Or we put out a flyer. And we're like, okay. That should be like a whole course. How do you get people to come to you? Okay. Little Jeremy is quietly playing with his blocks, occasionally looking over to the kitchen to make sure his mom is still there. Mom's preoccupied while doing last night's dishes. She's tired of her husband's drinking and feels like saying something, but she dreads the fight that will unfold when she does. She looks over and sees Jeremy playing and has an urge to hug him. Unaware, she's looking for comfort for herself. As she reaches out to pick Jeremy up, he protests, wanting to continue playing with his toys. Mom reacts as though she's been slapped by Jeremy. Feeling rejected, she roughly drops him back to the floor and heads back to the bedroom. Jeremy notices she's leaving and becomes anxious, and he starts to cry for her. Angry with Jeremy, Mom lets him cry for a while to punish him before returning to the den to pick him up. Okay? So this idea that I need this child to comfort me when I need it, and that child doesn't respond, it's going to be really painful, and my instinct is to withdraw. Okay? All right, so now let's get into the behaviors that happen here. Our anxiety-based responses to life can include overreactivity, image management, unrealistic beliefs about our limits, and attempts to control the reality of others to the point where we lose our boundaries, self-esteem, even our own reality. Okay, let me find, okay, hang on a second. That's the family, hang on. All righty. Well, let me give you this one. Jim and Diane have been divorced for the last 10 years with rare but in high conflict exchanges when they're forced to speak regarding their now adult son, Terry. Terry's 24 years old and struggling to find his direction in life. He has a history of not completing coursework or prematurely quitting jobs, and it was Diane's position that he just needed to have time to find himself. When Jim pressured her to set some boundaries with Terry, she would try, but found his silent treatment and avoidance of her so painful, she would soon relent on limits she set with him. While Jim clearly thought Terry's lack of progress in life was connected to his marijuana use and alcohol intake, Diane patiently sat through long conversations with Terry as he read the latest report on the internet, justifying the harmlessness of marijuana and dismissing her own ideas. In her mind, the priority was to keep the line of communication open and not threaten the relationship by taking a hard line. She'd watched Terry distance himself from his father as Jim grew more vocal about Terry's lack of progress in life, and she was really afraid this could happen if she pressured the issue too much. Okay? So this idea that, and you hear the, okay, but we need to keep the lines of communication open, which is true. Okay? But in her case, it's code for, I don't want to rock this boat. So yeah, sitting and listening to him explain all about how his marijuana is just a herb, and it's good for him. Okay? So our first symptom you're going to see is avoiding awareness of our own reality. It's an attempt to deny our thoughts, desires, or attention from those that we feel are going to contradict the needs of those we feel strong attachment to. So we instinctively hide our feelings and thoughts we assume to be threatening to other people. Okay? We're really afraid that if we say what we need and what we want, they will make the obvious choice, which is to not be with us, just like she was afraid of, Diane was afraid of, which is, if I push too hard, that's it. He's gone. Not trusting that I'm a mom. Not trusting that I've had a relationship with this individual for 19 or 20 years or 21 years. It's like that didn't happen. Like that didn't happen. Did you have a question? Uh-huh.
For image management, you said our anxiety response to life can include overreactivity, image management.
Oh, image management. Uh-huh. Oh, you want to know what image management is? Okay, image management is when I spend a lot of energy trying to make sure you see me the way I want you to see me. Okay? So I'm managing my image. That's a term from Ann Wilson Schaaf, her book, When Society Becomes an Addict. And she also wrote a book on codependency. And yeah, it's sort of like, I need you to see what I want you to see. And that's all there is to see. Okay? Pardon me?
You said, I want you to see what I want you to see.
That's right.
Well, isn't it that I want you to see what you want to see?
Not necessarily. Not for codependency. I want you to see what I want you to see. I have an image of me that I want you to see. And I'm going to carry myself in the world pretty much like I'm all right. I'm all right. I've got it handled. I'm going to have denial of my own limitations. Okay? And if somebody questions my ability to manage what's the stress in my life, I'll usually poo-poo it. Yeah. Okay. So let me go. Symptom 2 is lack of attunement with others. Lack of attunement with others is we project onto people who we think they are, rather and meet the needs we think they have. It's kind of a weird sentence there. Sorry about that. Typo. Accurate empathy for others' feelings, wishes, beliefs, regrets, values, or purposes did not develop due to the lack of emotional attunement with our own caregiver. Part of the difficulty is that if you are going to develop emotional attunement, you needed to have emotional attunement and experience it. Right? The way I develop awareness of emotions or feelings or perceptions is that somebody says to me, "Oh, honey, are you tired? Are you frustrated?" Because children don't have emotional vocabulary. Okay? So somebody has to sort of help us develop one, which means somebody has to have the ability to see us and recognize us. All right? So this idea that because I've developed an awareness that when you ask me if I'm sad and I meant, oh, okay, that feeling equals sad, right? That allows me, when I see it, to know what it is. Okay? But a lot of early attachment damaged people didn't get seen. We didn't get seen, we didn't get heard accurately, right? So we don't read ourselves very well, right? I don't know what I'm feeling, what I'm thinking. I don't know what I need. So I'm guessing. Or I'm doing what I think I'm supposed to need, or what I think I'm supposed to want. Right? So I do the same kind of projection onto other people. And you'll see this a lot with couples where they'll come in and one of them will say, oh, I know him better than he knows himself, right? And they'll try to answer all the questions that you're asking about the other person. And they're not right. I mean, they're very frequently off the mark. But they're so sure they read that other person. And that's because we spend all of our time watching them. So we assume because we're hyper-vigilant that we're accurate. That's not necessarily true at all right? So we spend a lot of time monitoring, which doesn't necessarily mean anything. Okay, so for example, this idea that, let me see, okay. So how does this look when it works well? Okay, Marion and her adult son Jeff were meeting with the family counselor at the Treatment Center for Aftercare Planning. Marion had been attending Al-Anon and working with a sponsor for the last month, and had attended several individual sessions with the family counselor. Marion's primary pattern was conflict avoidance and difficulty setting internal, external boundaries with her son, who was often verbally aggressive with her and prone to blaming her when she attempted to hold him accountable for his agreements. As they were discussing the possibility of Jeff transferring to local sober living home after treatment, Jeff began to get agitated, aggravated that Marion did not want him to come home and live with her after treatment. At one point, Jeff began to raise his voice, demanding that Marion tell the counselor the real reason she wanted to get rid of him. Jeff was referring to Marion's desire to move forward in a long-term relationship with a man who had witnessed Jeff's verbal abuse several times and had made it clear he would not be able to live in this situation. So he says, "You're choosing that control freak over me." Okay? And Marion could feel the tears, come up in her eyes. However, she prepared herself for this in an earlier session, so she was able to say, "Jeff, I want you to live in an SLE instead of coming home because I want you to see, and I want you to begin to live more like an adult. Most of all, I want to have a different relationship with you. I honestly believe this is our best shot to make that happen." Now, Marion still cried while saying it, but did not allow her focus to be shifted or let go of her position to avoid Jeff's possible feelings of rejection. And strangely enough, the meeting continued without the explosion she most feared. Okay? So by holding her own and allowing him the space, right, instead of jumping in and taking care of it. "It's okay, honey. No, it's all right." Right? Which had been her usual, "It's all right. Don't get upset. Don't have feelings about this." It's like, "No, you know what? I need to do what I need to do. I do want a relationship with you," and let him just feel what he's going to feel. That's really hard. And people need support to do that. I mean, they can't just do that. That is not the first time he's accused her of abandoning him, right? "If you loved me, you would let me fill in the blank," right? "You'd buy me a fourth car, even though I ran the last 3 into a tree, if you loved me." Which is really hard for codependent parents, right? "If you loved me," that gets us. Okay, distrusting the attachment of others to the codependent. We don't trust the motives and strengths of attachment others have for us. Waiting for the shoe to drop and assuming our value lies in what we do, not who we are. So resent the overgiving we have to do to stay in relationships. So we have a tendency to believe we are what we do. And the only reason you would choose to be with me is because I can be value added, right? So you're going to stay with me because I pay your rent. The problem with this is then if you tell me you love me, I'll say, "Yeah, it's because I pay your rent." So there's no way for us to feel loved because we set it out from the gate in terms of, because I don't trust this relationship, I'm going to need to sweeten the pot, and then when you thank me for that, I go, "Yeah." Right? And so we're kind of tough to be in a relationship with. Because sometimes with codependency, you see this with their adult children, right? I mean, this idea that, "Yeah, I'll go ahead and pay for your outpatient treatment," right? Or "I'll go ahead and pay for that. I'll pay for that your first apartment, your front, And then the child says, "Thank moms, I love you," and they're like, "Yeah, yeah, it's because I paid." Yeah.
It strikes me when your example a moment ago about the addict being so upset that you're making you live in an SLE.
Yeah.
I mean, it strikes me that typically, the addict, because they have arrested development,
Yes.
they're actually terrified too, because
Yes,
now
they are.
the parent is requiring them to step up in their development, and they're so fearful of that. So it's not just manipulation, it's terror on their part too.
You're exactly right.
Yeah.
You're exactly right. I think the skill set for adult addicts is manipulation because that's what they've learned to do. But you're right. Underneath that is a terror. Okay? They're both afraid. They're both afraid. And so the empathy, right, would be for Marion or the mom to stay level, right? And say, because really that's part of good parenting is nurturing, right? I'm going to be the safe safety net. We're going to do this, honey. It's going to be fine. But to do that, not at our own expense. Okay? Where normally what you do is, it'll be fine, it's all right, and then give up whatever I need. Okay? You're exactly right.